So sleep and depression. Sleep, it seems like such a simple thing, but it's a complex issue. And you're saying, why are we talking about sleep when we're talking about depression? One affects the other. So sleep is important for everything, including your weight, repair, and inflammation. So your body's ability to repair itself and lower down inflammation. Inflammation causes pain, cancer, a variety of bad things. You need proper sleep for your hormone function, all those hormones, and your brain chemistry, so feeling good. There's a reason that sleep deprivation is an effective torture technique. So that's a big thing we talk about in our office is how is your sleep, and that's something we bring up every time someone comes in is how is it. So let's talk a little bit more about that.
How do you know if you're getting enough sleep? This is a big one because lots of people say, oh, my sleep's fine. And then as we ask more questions, they realize their sleep's not that fine. So most people need between 7 and 9 hours. There are very few exceptions to that, although I do know some personally who need less sleep or more sleep, but you are probably not one of the exceptions. And go on the rule that you're probably not. So between 7 to 9 hours, it should take you 10 to 15 minutes to fall asleep. If it's taking less time than that, you're exhausted, like dead tired. You're hitting the pillow, you're out cold. That's not what we're looking for. If it's taking you more around the 20-minute to 30-minute mark, there's another indication that we need to figure out why you can't fall asleep, and we need to bring that down so that you can settle in. And that could be your body, it could be your brain, it could be noises, it could be all kinds of things. Waking up without the need of an alarm. How many of you can wake up in the morning, no alarm, but on time and get to work? Okay, a few of you, this is good news. A lot of people can't. They cannot. It is not going to happen. Sometimes with 3 alarms, they still cannot get out of bed. Feeling rested in the morning. A lot of people, when I say, when was the last time you felt rested? They do the same face you're making right now. People feel rested in the morning. They're shocked. They have no idea that they can wake up and go, yeah, here comes the day. Staying asleep through normal household noises. There are a lot of people say, oh, I've been a light sleeper all my life. Well, it doesn't make it normal. You should be able to sleep through normal sounds in your surrounding, which includes snoring husbands. Now, there are a few snoring husbands that are more freight train-like. There's some exceptions to this. But even that, if that freight train is beside you every single night, your nervous system should realize at some point that that's not something worthy of waking up to. And if you're still waking up to that, then we need to work on getting you into better sleep. And then if you are awoken, I mean, I have a 4-year-old, Whitney has a very cute little baby. They wake us up. Can you get back to sleep? That's big. And animals, cats, dogs, they can do that too. So getting up, going to the bathroom, tending to what needs to be tended to, getting back into bed, and falling back to sleep. Again, that's when you want more the 5 to 10 minutes passing out. You should be dog tired and hitting the pillow. That should be it. Or not even remembering that you woke up.